I started my university journey back in 2007, where I applied to study pharmacy at the School of Applied Sciences. Pharmacy is something close to my heart, and I've always been passionate about helping patients, helping people in general. From a young age, I remember doing my work experience back in year 10 at age of 15, and I started off in optics, working for Specsavers opticians. I had an interest in it, but I thought I wanted something where every day was not going to be the same, where someone could come in and it could be something different. They're presenting complaint. It could be anything, from conjunctivitis to the eye, to a sprained ankle, or something more sinister which may need referral and intervention. And pharmacy, no day really is the same for me. When I work in community pharmacy, each and every day I'll come across something different, something which I may need to research on and learn a bit more, but that's what I like, it's the variety. And I just really enjoyed the kind of patient-centred sort of interaction. I can talk for England. I enjoyed communicating with patients, talking to them about their health needs and concerns, and just trying to make a difference wherever I could. So that's how I kind of got into pharmacy. I've always been passionate about science and technology, in terms of biology, how the human body works. Chemistry was always fun, from experiments to extemporaneous dispensing at university, manufacturing medicines, making medicines. I think the pharmacy degree itself, the variety was great, as in we did have labs, but we also had a lot of interaction sections where we would be video counselling patients and we could watch ourselves back. It's hilarious when you look back at your CDs and you see yourself for the first time trying to diagnose someone's condition and recommend treatment. I had a brilliant time throughout uni, really enjoyed my experience. Contact time we had with our lecturers was brilliant. We got to know them on a personal level. Every year we had placements, so we would actually go into secondary care and primary care. We'd go on ward rounds, so we'd learn kind of how secondary care worked, but then also earlier on in the degree we'd go into like community pharmacies, like local, from Rowlands to Lloyd's, Boots, and build sort of links from there. From just doing like little work placements during our course, that was kind of like the foot into the door really, if you wanted to kind of pursue like a summer placement. So when you finished uni and you've got so many months off from May to September, you could almost get your foot in the door and apply, put an application in, which is what I did with Boots, and then that kind of led me into my pre-reg with Boots after uni. So the main reason for taking up boxing at first was just to keep fit, and then from that I watched my gym buddies really, see them compete at tournaments at national level, area level, and just watching them, it kind of really gave me a buzz that, why not, maybe I could give it a go. And when I saw this opportunity that I'm in a position, as a Boots Macmillan information pharmacist, that I help cancer patients, that we can actually help this charity, Cancer Research UK, a charity very close to my heart. As I say, I've had family members suffer from cancer, and I've seen them fight the condition firsthand. You see what it does to them, when the doctor first diagnoses someone and just says the word cancer, it carries so much, negative connotations, and it can really make them quite emotional. And seeing that firsthand gave me the kind of driving force to actually do this. That I can merge two passions here, helping people, helping cancer patients, and then by doing it through something that I quite enjoy and I'm passionate about as well. It's taking place on the 1st of October at Wolverhampton Civic Hall. So yeah, if you can make it, definitely come down. It'll be a great night of entertainment, but it's also for a great cause. As I say, we're helping beat cancer. So I think Ultra White Collar Boxing's aim is to hit 5 million this year, to raise £5 million for Cancer Research UK. Win, lose or draw, at the end of the day for me it's all a great cause. I'm mainly doing it for charity. I'm mainly doing it to help someone somewhere along their way. And it's a challenge. I relish a challenge. You know, it's definitely taking me as a pharmacist outside of my comfort zone. And sometimes I think it's worth just challenging yourself and see where you can take things.